So we got 1, 2, and then
Hello.
1, 2.
Hello.
Boom.
And Liam counts.
Yeah, Liam counts. So he acts like 60-year-old. Alright. Vaccinations in public school systems. The purpose of this report is to persuade the officials in my city to make it legal requirement for parents to fully vaccinate their children before putting them in the Columbia County's district public school systems with no exceptions, unless child has allergy or compromised immune systems. The number of children being exposed to and catching preventable diseases is at a high, and herd immunity is starting to dwindle, which poses a threat to infants, immune-deficient individuals, and senior citizens. In 2005, there was only 79% of pertussis, which in 2011 there was 180, more than double ever since 2005. There was also the first reported case of measles in Georgia since 2012 in Atlanta. Vaccinations were created to help prevent such diseases, but recently parents were opting out of vaccinations. In order to bring the number of cases down, vaccinations should be a legal requirement. I have conducted much research on the rise of preventable diseases and the importance of vaccinations. I have searched many databases and the Center for Disease Control Statistics in my state. According to Penn Bioethics Journal, a study done on the diphtheria vaccine showed that in New York before the vaccine there was roughly 175,885 cases of diphtheria. And in 2009, after the vaccine was introduced, there were zero reported cases. These statistics alone show the importance of vaccines. Vaccines were introduced in modern medicine to help prevent these diseases such as measles, diphtheria, pertussis, which is whooping cough, chickenpox, mumps, and rubella. The only argument against vaccinations is the fear of it causing allergies or autism. Both of those arguments have no evidence linking the two with vaccinations. Herd immunity is the general immunity to certain diseases because the general population is vaccinated. This protects infants, senior citizens, and people with compromised immune systems. The anti-vaccination movement has been threatening to herd immunity because we are now dropping below the threshold. People who choose not to vaccinate are solely relying on those who do choose to vaccinate to help with herd immunity. Jeffrey Kluger wrote in Time magazine that in 1952 there were 57,879 cases of polio. 6 years after the vaccination for polio was introduced in 1961, the numbers dropped 98% to 1,312, and now the number is 0 cases of polio. This shows how well vaccinations truly work. The numbers speak for themselves. This photo that I'm about to show gives an example of the importance of herd immunity. If people are not vaccinated, the disease will spread like wildfire through our community. So as you can see, these are the people that are not immunized, and they're sick and contagious. And then these are the people that are not immunized either, but they're still healthy. And then as you can see, two people go over there and they create everybody else to get sick. And that's why everybody needs to be immunized, and so that way they can stay healthy. The Center for Disease Control out of Atlanta, Georgia, conducted a study on unvaccinated children. The majority of them were Caucasian, with a married mother and an average family income of $75,000 or more. The reason why they are refusing vaccinations for their children is a fear of side effects linked with vaccinations. There has been no solid evidence that says vaccinations are linked with allergies and autism. Because of the incline of people refusing vaccinations, the number of preventable diseases are steadily going up. According to Mike Midka, a study was performed on pertussis cases between 1996 and 2007. And even though unvaccinated children only make up 0.05% of the study, they are contributed to 12% of pertussis cases. This is a very shocking ratio. The study also looked at people who did not receive the vaccinations due to religious or other non-medical reasons, and they made up a large number of pertussis cases. In 2008, the CDC states that about 85% of children between the ages of 19 months and 30 months were effectively vaccinated for pertussis. Pertussis is at its all-time high in the last 50 years. According to Mark Fischetti in 2012, the number of reported pertussis cases were 42,000 people. This is the highest amount of reported cases of whooping cough since 1955. Whooping cough can be life-threatening to infants. There is a vaccine for whooping cough, DTP vaccine, there's a vaccine for whooping cough, DTP vaccine, which prevents diphtheria, tetanus, and pertussis. All three of these diseases have been increasingly being diagnosed in America. In the public health reports, Kennedy states that measles vaccinations typically remain at about 90% to help prevent outbreaks. Lately, though, groups of people opting out of the measles vaccine have caused small outbreaks amongst the religious communities. This can create an epidemic nationwide, though. In 2005, there was a measles outbreak because a 17-year-old contracted it while out of the country and came back. The church was all unvaccinated, so they all contracted measles after going to church with this girl. This could have been prevented had the people been vaccinated. This graph that I'm about to show shows the rising rates of measles in the United States. This is a drastic rise since the anti-vaccine movement has become as big as it has. There's absolutely no reason the measles rate should need to be this high. And as you can see, from 2004 to 2014, it has risen up to 644 cases nationwide. A little bit of pros and cons about why we should receive vaccinations. Let's talk about the pros. The pros to receiving vaccinations should be quite clear. The rising rates of diseases should be enough to warn parents how important vaccinations are, or so you may think. Many of these diseases can be life-threatening to young children or individuals with a compromised immune system. 1, herd immunity would still be able to protect individuals who medically cannot receive the vaccinations. 2, it would prevent outbreaks of certain diseases and eventually completely wipe out said diseases. Protect children with medical reasons that prevent them from being able to receive vaccinations. Lower medical bills for those who could contract the disease, and lower mortality rates. People really need to understand the importance of vaccinations and everything they could help. They were introduced into modern medicine for a reason, and they are there to help. Let's look at the cons. Anti-vaxxers like to say that vaccinations can cause autism. The only thing that they are lacking is hardcore proof and evidence to back up their statements. The only con to getting a vaccine, like many other medications, is the risk of an allergic reaction. This is an inevitable instance, though. The pros definitely outweigh the cons when it comes to vaccinations. This report has presented much information about the importance of vaccinations. Children attending public schools in the Columbia County School District should be required by law to be fully vaccinated unless there are medical reasons preventing them. If a parent wants to refuse vaccinations due to religious or other reasons, they should not be able to attend a public school. It is not to be cruel or to be discriminate against beliefs, but merely to protect the children who cannot receive the vaccine due to medical reasons. It is very important to keep the herd immunity threshold at its highest point to protect young infants, children with compromised immune systems, and children with an allergy to the vaccines. This can help all the nation's cases of preventable diseases die down. My recommendation, it is very important to keep the rising number of preventable diseases down. Although many people are starting to follow the anti-vaccine movement, it needs to be stopped in its tracks before an outbreak happens. It is my ultimate goal to keep immortality rates and hospital rates down and protect these young children who cannot receive vaccines. I fully recommend making it a legal requirement for all attendees of public schools in Georgia and all around to be fully vaccinated. Offer free classes to parents about the importance of vaccines. Offer free vaccines in the school, if applicable, and keep parents updated about the rising causes of preventable diseases. And that is it. Let me pan it on the audience one more time. Got 2 over there, 2 over there, boom, and